can you say about the injuries? What type of injuries?
Maybe Andy would speak a little bit more about
Sure.
that.
There were multiple injuries related to lacerations or cuts, most likely, as the Chief said, from the stab wounds from the butcher knife. Then there were a number of people that had orthopedic and other soft tissue injuries related to being hit by the car initially. It's our understanding from the other hospitals, and it's our knowledge here, that none of the individuals appear to have life-threatening injuries at this time.
Will they have to have surgery?
One had, actually two. Have they had surgery? Yeah, two have completed surgery at this point here, mainly for orthopedic issues.
Are they students, faculty, staff?
We're going to release more information with the university at a later time.
Talk about how you called for staff to come to the hospital. Talk about that. We saw them arriving to sleeves rolled up, ready to go.
Yeah, so we have a process that's actually university-wide. When the Buckeye Alert goes out, we jump into action. The active shooter protocol is something that went out across campus, but also we internally have what's called a code yellow or disaster drill. We immediately made phone calls to key individuals, both the emergency department, our surgeons, our nurses, our respiratory therapists, and people just descend. We train for this. We work with the other hospitals in the city and the Central Ohio Trauma System to train for exactly these types of events. But I can't tell you how proud I am to work here at the university and to see my colleagues come together in a moment that all of us would really hate to ever have happen on any campus, much less our own. But it was great to see the response, and I'm glad people were not any further injured than they were.
Dr. Drake, back to the mics. If you could talk a little bit about the mood on campus now, and you've just come back from Thanksgiving break. This has got to be a tough time. We could see it on the faces of students here.
Yes, this is obviously a tragic situation and something that, as Andy was saying earlier, we prepare for every year. Our students, our faculty, our staff are all trained because we've seen things like this happen around the country, and the best that we can do is to be prepared and then respond appropriately. I did want to say that we were so grateful that our police were there on the scene, able to neutralize the situation, that the injuries were not more severe than they were, and that, as you understand, people have been to the hospital already, treated and released in some cases, operated on, but out of the operating room already in other cases. So we're pleased that those injuries aren't any more serious. I'll be able to go and visit those who were injured a little bit later on this afternoon.
What do you hope to say to them?
What I say to patients, regardless of circumstances, that we're here for them, and we want to do everything we can to help them have a full and complete recovery as quickly as possible, and just let them know that we care about them as people as well as patients.
How do you assure students, parents, that when campus reopens, they'll be safe when they come back here?
You know, we all do what we can to be as safe as we possibly can, and we all have the normal safety protocols in place, and we all live with the fear that things like this can happen to us. And so, but by being diligent and focusing, we believe we can be as safe as possible. And again, with our safety personnel and officers here to respond and help protect us, we're pleased that this was no more serious than it could have been.
Talk about next steps.
What do you plan to do about classes? Did you cancel classes? Or?
We canceled classes today. This was quite disrupted this morning, and we wanted to, even though the situation appeared to be neutralized relatively rapidly, or very rapidly, we wanted to give the police a chance to begin their investigation, and so we held people in place until we felt that the campus was entirely safe and secure. Pleased that that was the case. But now we've disrupted the schedule for half a day. It's emotionally draining and quite frightening, and so we wanted to say that this is a good day to take to step back from classes, sort of get our footing, and then open again tomorrow.
Sir, can somebody speak to the nature of the alert that went out that said run, fight, hide, or something to that effect? Is that a normal alert? Or
yeah, so we have a protocol that we rehearse for what one should do if one engages an active shooter. And what I heard at first was that there were shots fired on campus, and therefore the active shooter protocol was going to be put in place, which is to do as much as possible to protect people, which is to not engage, to find some place to be safe, and to hide in place while the professionals arrive to neutralize the situation. So the first thing, our first order of business then was to make the campus safe and secure, and that happened, as you heard, within minutes. And then we investigate, and when we have information that lets people know that it's safe to resume normal or most normal activities, we allow that to go, that information to be shared. And we do that through text messaging, and it spreads rapidly throughout the campus.
Can you repeat your name? I'm sorry.
Yes, it's Michael Drake.
Run, Hide, Fight is an ongoing training program. Run, Hide, Fight is an ongoing training program, and so when you see that referenced in an alert message, that rings a bell with members of the campus community that have been through the training.
Talk about, there was a student hiding, so something must be getting through as the medical professionals talk to that. There was a girl hiding inside.
The public safety team has done a lot of training across the community, and again, that's why they use those keywords in an alert to remind folks of what their options are for any violent intruder, whether it be someone with a gun or a knife like today. Those same principles apply. So those are kind of keywords that we use to remind people of their training.
And Mayor
Mayor
Ginther's,
Ginther?
yeah, he was, if you just say a
What
word.
words did you have to say for the community?
Well, obviously, this is a city made up of great neighborhoods, and we're in one of our greatest neighborhoods. And so we're here to show our support and solidarity with President Drake and the entire university community. Lift up in our thoughts and prayers the victims of this senseless tragedy, and grateful for our first responders that were on the scene and helped to ensure that the situation did not escalate dramatically. I'm here with Chief Jacobs and Chief O'Connor. I want to send a clear message to the university and to the entire community that the City of Columbus will devote whatever resources are necessary and work closely with President Drake and his team to make sure that everyone feels safe in this neighborhood and throughout our great city. And grateful again for Dr. Thomas and Dr. Retchen and the amazing folks here and at the other hospitals that are treating some of the victims here today. But want everyone in Columbus to continue to lift up in our thoughts and prayers of the victims and their families.
Dr. Drake, talk to us about, what will you say to the parents of students here? I have 2 college-age students, so I know how difficult it is
Yes.
being away from them. Talk to the parents and the families of what they can expect and what you're doing to keep their students safe, and also talk to their emotional and social needs.
Well, as again, repeat what the mayor said, we're pleased that no one was injured more seriously.